Hello all. Our question for today is define public health, describe the characteristics of public health methods, and write briefly about functions of public health dentist. It is a 7-marker question and very important in final year exams. I've prepared this answer from Sobin Peter. So let's begin with the definition. It was given by Winslow in 1920. He defines public health as the science and art of preventing disease, prolonging life, and promoting physical and mental efficiency through organized community efforts for the sanitation of the environment, the control of communicable infections, the education of the individual in personal hygiene, the organization of medical and nursing services for the early diagnosis and preventive treatment of disease, and the development of the social machinery to ensure everyone a standard of living adequate for the maintenance of health, so organizing these benefits as to enable every citizen to realize his birthright of health and longevity. I've colored various parts of this definition. I know it's long, but this way you can remember it easily. Of the characteristics of public health methods, the first characteristic is the recognition of group responsibility. Public health work exhibits a certain number of characteristics that are different from individual practice in the same field. Most important is the fact that public health work must be done in areas where group responsibility is recognized. This concept led first to quarantine and isolation procedures and later to mass preventive measures. The second characteristic is that public health work relies on team effort. Large groups of people can be handled much easier as a team in institutional surroundings with systematic allocation of many procedures to properly supervised auxiliary personnel. Also, many processes involved in prevention lend themselves particularly well to teamwork. Third characteristic is the prevention of disease, which is the main goal. Prevention is a major objective of public health programs because of three reasons. The first reason is ethical, that prevention of disease is an even greater good in life than the cure of the disease. The second reason is the advantage of teamwork. And the third reason is cost efficiency, since prevention is economical than cure. Fourth characteristic is the concept of medical indigence. Medical indigence constitutes an inability to pay large bills for medical care. This situation is chiefly found in the case of chronic diseases, where the life savings of otherwise independent people are easily wiped out. Example, the treatment procedures for cancer is expensive. Public health dentistry makes oral health care available to every individual irrespective of their socioeconomic status by obtaining governmental or non-governmental funding. Fifth characteristic is that disease is considered a multifactorial problem. Public health work deals with all sorts of problems involving the host population and the environment, which is beyond the range of the individual professional. The disease is no longer considered a phenomenon caused by one agent within the individual patient, but can be studied on a community-wide basis and can be recognized as a multifactorial problem. Sixth characteristic is its dependence on the biostatistical method. The presence of a disease in an individual patient can usually be described on a yes or no basis. The same disease would probably be present at all times in a large population group, its frequency affected by a multiplicity of factors. Since changes in the prevalence of disease can be measured only by observations over a number of years, the time factor becomes important to accurately measure rates. Mathematical measurement of probability becomes necessary to find out whether differences between rates are real or merely chance phenomenon. Seventh characteristic is that public health worker deals with the healthy as well as the apparently healthy. The public health worker, in his efforts to attain prevention of disease, deals with healthy or apparently healthy people as well as with the sick. This brings a cheerful, hopeful atmosphere to the work. In addition, it also brings with it certain problems. The worker must go looking for minimal disease instead of waiting for frank disease to come to him. He must adapt himself to those testing methods which can be used effectively on large populations. He must also learn to take more satisfaction from the recognition and interception of early disease than from the control of advanced disease. From the public's point of view, it requires a stretch of the imagination to realize the need for periodic health examination and to accept preventive measures, especially for those diseases which do not have disabling or fatal effects. The last characteristic is the adaptation of programs to community culture. When public health agencies become involved in the delivery of care to people in disadvantaged or isolated locations, attention should be given to the location and transportation to healthcare facilities. Care should be brought as close as possible to where the people are normally concentrated. Hence, the advantage of neighborhood health centers or of school-based dental care facilities for school children. Whenever certain health measures which are contrary to accepted cultural patterns are introduced in the community, people are known to react in an apparently strange manner. The social sciences such as cultural anthropology and social psychology helps in understanding why people react in this manner, thus helping in adapting public health programs to community culture. There is a mnemonic to remember the characteristics of public health methods, which goes like: responsible team prevents indigence, managing biostatistics, and helping communities. Functions of public health dentist. Remember, there are 7 functions and 8 characteristics. So the first function is health education and motivation of the individual or community for improving their oral health and for availing dental services. Another function is to deliver dental treatment to the community through organized dental health camps, especially in rural areas and for the dentally indigent. Third function is to provide dental prophylaxis and oral hygiene measures, including instructions and home care of the mouth. Fourth function is the application of caries preventive measures such as topical application of fluorides, pit and fissure sealants, as well as delivering dental care for children through the school health programs. Fifth function is the demonstration of new dental preventive methods and procedures to the community. Sixth function is conducting dental public health activities and field experiences for dental students. And the last function is participating in community activities like proposal to build a new school building, fluoridation of drinking water supply, expansion of recreational facilities for children, building a community health center, or to discuss community health problems. Thank you for watching this video. If you like this video, please subscribe to my YouTube channel. Stay tuned for further videos.